think it was probably the end of my junior year, so I had one more year to go.
Okay.
And I just came back full circle. I think I was doing a lot of volunteering. I was volunteering in a free clinic for the homeless. And
at that time or prior?
At that time.
Okay.
And I figured, my passion and my mission in life is really to help people. And, what better way to help people than to go into health. So.
What made you decide to go into ER?
I loved being able, the immediacy of being able to help someone. Someone comes in with a broken bone, you set it immediately, you splint them, and you fix them and they go on their way. Or somebody has a big laceration, you just sew them up. So I loved that sort of immediacy, and being able to help all sorts of different people from all walks of life. They could come in with anything, and.
But didn't you feel sometimes? I mean, you're in the States.
Yes.
And everyone doesn't come in quite. I mean, they're not as passive or docile as a lot of people in Asia, in Japan.
No, not at all. Not at all.
So didn't you have situations that?
I go crazy. It was crazy. I was in New York City for 15 years. So.
Wait, where were you first? Where did you start practicing first?
New York City.
New York City.
Yes, Manhattan. So yeah, there were plenty of things that are unimaginable here: gunshot wounds, a lot of stabbings, a lot of trauma, a lot of drug and alcohol abuse. So it was a crazy, crazy world.
Now, outside of the music and the commercial breaks, how close is it to the real series like ER? Your life there. When you saw, I'm sure you've seen those series.
Oh yeah.
What do you identify with, and what do you call BS on?
I think the drama and the relationships that go on behind the the curtains or whatever. But no, it's as crazy as television, if not crazier. I didn't watch those shows very much when I was in them, because it's that was my everyday life. It's I don't want to go home and turn on the TV and watch the same thing. So
right.
Yeah.
What did you find for relief?
Other doctors, friends, people who were not in medicine, reading books. I was into music. So yeah, part of what I liked about ER is when you're in it, you're fully 100% in it. You're treating people, you're seeing people from all walks of life, but then at the end of the day, after your shift is over, you can have a whole separate life. So it gave me that sort of flexibility between work and the rest of my life.
Did you ever feel threatened?
Yeah, absolutely. There are definitely people who come in who threaten you if they don't get what they want. They come in wanting painkillers or, So.
And what would you do in that situation? How do you handle it?
I made sure a security guard walked out with me when I left my shift.
Did you have to do that often?
Sometimes, yeah.
Wow.
Yeah. And I love working in the ER. I mean, it was very gratifying in some ways, and it could be very frustrating in some ways. And the thing that I realized, though, even though I loved being there and I loved working, I loved the immediacy of being able to help people, I realized after a number of years that 80% of what came through my doors could have potentially been prevented.
That's where we're going to go. There you go. Now, how?
Yeah.
How would that be prevented? When did you realize this?
I think it took me about 10 years of working. And you would see the same people coming in, week after week with terrible asthma or heart failure. And between all the, the drug abuse, the traumas, even infections, heart disease, all of these things, 80% of that could have potentially been prevented. So then that started a mind shift with me that, okay, well, we need to treat these patients a little further upstream, right, before they get to that point. And what can we do for that? So I became interested in something called lifestyle medicine. And that's, kind of a brand new field in the United States, and I'm sort of helping to bring those concepts back here to Japan, where, through various lifestyle modifications, and some of the, for the 4 pillars that I always talk about are eat, sleep, move, and relax.
Okay.
So between, good nutrition, sleeping enough, exercising, and relaxation is really about human connections, how you de-stress, how you manage your mind. All of these things make a huge impact on your health. And by being able to teach people about these things and having people manage their health in that way, potentially they didn't have to go through that. They potentially didn't have to be in that ER, when I was treating them. So.
Did you start talking to people about this when you came to this realization? About 10 years into it?
No, back then the field wasn't really in existence.
Okay.
And 8 years ago, I had the good fortune of coming back to Japan. And I think that was another mindset shift. And I think that really got me thinking in the path, like even cancer. Right now I work in a Tokyo Cancer Clinic, which is my father's cancer clinic. And it's a small clinic and we specialize in immunotherapy and cellular immunotherapy for cancer. And even with cancer, 40% of cancers can be prevented. So, it sort of tied in with my ideas that, a lot of these chronic illnesses can be prevented, and how do we go about doing that? So I did a lot of research on my own, and then after studying it for a few years, I realized there was actually a board of lifestyle medicine. Mm-hmm. So, I studied.
Well, here in Japan?
Actually, no, it's in the United States.
Oh, in the United States, okay.
So.